three intensity zone model based on the physiology, where you have a first turn point and a second turn point for lactate. The first is a kind of a subtle increase that can be compensated or can reach a new steady state. If you keep increasing the intensity, you reach a point where now lactate just continues to climb until fatigue, or until you stop exercising. So that was, we use this 3-zone model. And my brain said those are going to each have different consequences. But then subsequent research on the stress aspects of it, using heart rate variability recovery and things like that, suggested that actually once you induce that big stress response, once you start really turning on the autonomic nervous system, the sympathetic nervous system, the body doesn't really distinguish. And so more and more, 25 years on, I would say it's almost like training comes down to 2 zones, a low stress zone and a high stress zone. And that's been, I think it's been supported by subsequent research, and it's totally consistent with what we see athletes kind of self-organizing towards, as far as I can tell, after all of these years of trying to understand it. And it seems like that polarized distribution, where a lot of the volume is extensive and at a more moderate intensity, is more sustainable because you don't trigger that big stress response. You get a lot of cell signaling, you build mitochondria, you get the capillary density changes, you get even cardiovascular improvements. You don't have to do intervals to get a VO2 max improvement, turns out. And so you get a lot of that at a fairly low stress cost. And
pyramidal training versus polarized training, where do you fall on pyramidal versus polarized?
Starwell and Spierlich, they were the two guys that introduced the term pyramidal. They did a nice review, and I was actually a reviewer of that paper. And I can recall the first version of it, and I said, yeah, you're onto something here, and I think you're right. I think the term polarized is being used inappropriately, because it's not always truly polarized what's being called polarized. And so they ran with it, and they demonstrated and showed that, yeah, a lot of studies, it's actually this kind of, it was always consistently a lot of low intensity, but then the threshold versus above threshold, that distribution wasn't always polarized. It was sometimes, what they called pyramidal. And we've seen that with runners, we've seen it with cyclists, and it's true. And the consistent part is about 80% of training sessions, maybe 90% based on time and zone, is in that low intensity zone. But how the rest is distributed varies quite a bit. What determines that? It's event duration, where they are in the season, and probably also some individual issues of how they tolerate different load or intensity regimes. If I use an example of myself, an old guy doing intervals, I handle short, hard interval sessions pretty well, but a really long threshold session will kick my butt. Probably because I get so glycogen depleted, and I've got a lot of fast twitch fibers, relatively speaking. So I play in my wheelhouse with more stochastic, high intensity. It fits my physiology better, and I recover better. I need the long, tough threshold sessions, but they're tougher for me. Now, a super slow twitch diesel athlete may be exactly the opposite. They could go all day at threshold, but they'll struggle with a 30-15 workout. And the other thing about this pyramidal versus polarized, which I think makes the whole discussion a bit artificial, is that even if I do a nice polarized power distribution, the heart rate based data can look pretty darn threshold. For example, if I do 30-15s, you can end up, you look at it and say, well, that looks like upper threshold, but I was cranking some pretty big powers here. Well, yeah, but you were you were doing them for short periods, and then you were getting recovery. And so you get this dissociation between the central point of view cardiovascular response, which is based on overall oxygen demand, and the peripheral point of view, which is the localized recruitment of muscle with these high intensity accelerations. So there can be a disconnect between those two. And the one looks like threshold and the other looks like a high intensity session. So that also contributes to confusion in this pyramidal versus polarized discussion. So have I muddied the waters